My name is Tanya Mays.
Valerie Trainer.
My name is Yalak Baru.
Tiffany Williams. I was diagnosed with multiple myeloma in November of 2012.
Back in 2015.
I was diagnosed at age 25.
In October of 1998.
It's going on 18 years.
Multiple myeloma is twice as common in the African American community as compared to white Americans.
We know that there are tremendous health disparities in this country, and we see this particularly in multiple myeloma, in multiple different communities, but in particular, the African American community, where myeloma is twice as common, but the expected survival is only half that of white Americans. The IMF has taken on this health disparity challenge by creating the Empower program to empower individuals and communities to change this course of multiple myeloma. That currently what's happening is unacceptable, and we want to improve the outcomes of all patients with myeloma, including African Americans who have a shortened survival with this awful disease. And so the IMF is doing two primary moves. Number one, we're deeply engaging in the community, both medical and non-medical. So institutions like the National Medical Association and the Black Nurses Association, but non-medical organizations like fraternities and sororities and churches, to educate individuals and communities about what myeloma is, to understand the signs and symptoms so that they can seek medical help if it is that they may have something consistent with multiple myeloma, and also to reduce the stigma of this disease. But secondly, to work within the healthcare community, within primary care communities in particular, to raise awareness around what really myeloma is and to distinguish it from other diseases that may mimic myeloma, like diabetes, so that patients can have a reduced time from their initial symptoms to the diagnosis of myeloma. That's one of the great disparities in myeloma, is that it takes a long time for people to arrive at the diagnosis, and they may go weeks, months, if not years, with things like kidney damage and bone pain and bone damage because of multiple myeloma. This Empower program is a national program, but it's also a city-by-city program where we've worked in Charlotte, in Baltimore, in Atlanta, now within New York, in Tampa, and in the future, Detroit, as we systematically work through the country to try to raise awareness about myeloma and to improve the outcomes of patients with multiple myeloma.
I want us to envision a world without myeloma and what it would mean for each one of us as patients, as caregivers, and the broader myeloma